pre-COVID, you couldn't get anybody to attend online. And
Oh, really?
yeah,
Oh, wow. I suppose, yeah, everything changed. So
it sure did. Yeah.
I'm surprised our full department was, though.
Well, I
Okay. Well, thank you for coming today. This will be our Mayo Employees Federal Credit Union presentation on Medicare, and hopefully we'll be answering your questions as we go along. If you're online during the presentation, if you have any questions, you're welcome to submit those in the chat, and we, as I said, we'll answer those as we go along. My name is Dave Brown. I'm with TrueLink Medicare Advisors. We're a division of the Minnesota Credit Union Network. So the Minnesota Credit Union Network is a nonprofit advocacy group that does work for all the credit unions in Minnesota. And so we're a part of that, and we've been working with the Mayo Employees Credit Union now for well over a year. And we're here to be a resource for you if you need it. So anytime during the presentation, if you have a question, like I said, just raise your hand or ask as we go along. I've been doing Medicare for 17 years now, so I should be able to answer any questions that you throw at me. If I don't, I'll tell you I can't. So disclosures. For Minnesota at least, we offer just about every plan available in this area. There are 8 insurance carriers that offer Medicare Advantage plans, and there are numerous insurance carriers that offer Medigap supplement plans and standalone prescription drug plans, and we're licensed with many of them. The basics of Medicare. So if you watch TV at all, especially in the months of October and November, you get inundated with TV ads. If you're turning 65 or you're older than that, your mailbox fills up with mail pieces for Medicare. And one of the reasons Mayo Employees Federal Credit Union vetted us was to give you a resource that's going to help you give you some unbiased advice and a trustworthy advice. So that's what we are here to do. Our services, there's no cost ever to you to use TrueLink Medicare Advisors. If you sign up for a plan through us, we get paid a commission by the insurance carrier. If you sign up for a Medicare Advantage plan, several years ago, the federal government standardized those commissions, so we get paid the same no matter what insurance carrier you go with. And whether you go with a 0 premium plan or a $200 plan, we get paid the same. So we don't have a bias there in terms of trying to steer you one way or the other. With Medigap supplement plans, we get paid a percentage of whatever your annual premium is if you go with a supplement plan. So just wanted to help you understand that. Also, if you are a Mayo employee that was hired prior to January 1 of 2002, it's most likely you're going to have a company called Via Benefits that's available to you, and you would want to use them because they give you a health reimbursement account, a little under $1,800 a year to help pay for your cost. If you're hired January 1, 2002 or later, that service is not available to you if you are a Mayo Clinic employee. So just letting you know that. We can still help you. I just helped a couple this morning. I helped them get signed up for Medicare Part A and B. They do need to use Via Benefits, but we're here to help you irregardless of whether you need to use them or you want to go through us. We're available throughout the year for your questions if you have them and your assistance. If you ever have issues with your insurance carrier, maybe they didn't pay something that you thought that they should have or any of that, we're here to help with that throughout the year. And then every year we will review your options for you if you want us to. We'll send out a letter in August or September asking you to update your prescriptions and so forth. And if you reply to that, we have an option on there saying, I want to review my plan for the next year. So we will do that if you want us to. Original Medicare Parts A and B. So there's 2 parts that you're going to get through the federal government through Social Security. Medicare Part A provides coverage for hospitalization, skilled nursing, home health care, and hospice care. There isn't a monthly premium for Medicare Part A If you've worked in the United States for at least 10 years, you've had the Medicare tax taken out of your paycheck, and that's what pays for your Medicare Part A. For Medicare Part B, that gives you coverage for doctors and specialist visits, outpatient, things like surgeries and therapies, ambulance, medical equipment. That's what Medicare Part B is for, and there is a monthly premium for Medicare Part B. This year, it's $185 a month. You do need both Part Medicare A and B to sign up for some sort of supplemental coverage. If you're going to be collecting Social Security benefits at the time you sign up for Medicare Part B, that $185 a month will come right out of your Social Security check. If you're not going to be collecting Social Security benefits at the time you sign up for Medicare Part B, maybe you're delaying it till age 70 or something, they will send you a quarterly statement. And the first quarterly statement you get, there's a way you can set it up to come out monthly out of your checking account. If you choose not to do that, you'll get quarterly statements, $185 times 3, and you'll mail a check every quarter to Social Security. There are many things that original Medicare Parts A and B do not cover. They don't give you any comprehensive dental coverage. They don't offer worldwide coverage, routine hearing exams or hearing aids, fitness benefits, eye exams or eyewear, outpatient prescription drugs. So we're going to look at a couple different options here on supplemental coverage. Medicare Advantage plans are going to give you coverage for almost all of these areas. Medigap plans, that's just going to be your medical, and then if you wanted prescription drug coverage, you would buy a policy to add on to the supplemental plan. If you want vision and eyewear or vision coverage, hearing coverage, you would need to buy policies to add on to that also. So Medicare Advantage plans put all that together into one monthly premium. Medigap plans, you would need to add those types of things onto your coverage. There are different enrollment periods. The first enrollment period is called the initial coverage enrollment period, and it's based around the month of your 65th birth date. So it begins 3 months prior to the month you turn 65, the month of, and 3 months following. So you have a 7-month period initially based around your 65th birthday in which you can enroll in Medicare Parts A and B. If you or your spouse is going to continue working and you have employer coverage through them, as long as the employer has 20 or more employees and they offer creditable coverage, which the Mayo Clinic system does, you can delay enrolling in Medicare Part A and B. And again, that's if you're still working and on employer coverage, or you have a spouse that's still working and you're on their employer coverage, you can delay enrolling in Medicare Part A and B. Once your retirement or your spouse's retirement is determined, you would have what's called a special election period. And this is going to start 2 months before you're ready to leave your employer coverage, and it would continue for up to 8 months following retirement. You probably don't want to wait 8 months because you want it to be seamless. So if you're someone or your spouse is someone who's going to work beyond the age of 65, we can work with you once the special election period or once you get close to retirement. We can work with you on getting signed up for Medicare Part A or B and then get signed up for a supplemental plan. But again, if that's your situation, about 2 to 3 months before retirement, you would want to start working on that. Any questions on that?
So you can sign up before that begins 2 months, in 3 months?
You can start the process, yes, yeah. Some people, if they're in the situation where they or their spouse are still working, they may sign up for just Medicare Part A, which you can do at around age 65, and they would delay Part B. I get questions all the time, well, my neighbor told me if I don't sign up for it at age 65, I'm going to pay a penalty the rest of my life. We're going to take a look at, there's a form that your employer will fill out for you. If you work or you wait to sign up beyond the age of 65, that prevents those penalties. We'll look at that in just a moment. Every year, once you are enrolled in a Medicare plan, there's the annual election period, and that runs October 15th through December 7th of every year. And this is for people who are on Medicare plans. You can look at other options for the following year. And if you want to switch, this is the time frame in which you would want to do that. So if you're on a Medicare Advantage plan, those plans can change from year to year. They don't tend to change substantially, but they can. So if you wanted us to review your options once you're on Medicare, this is the time frame annually that we would do that. If you're on a Medigap plan, you would probably also have a standalone prescription drug plan. And that you would want to review every year because the prescription drug plans do change from year to year, and some of them change considerably. I've worked with people who, 2 years ago I met with a couple who, they were in their 80s now, but they had signed up for Medicare at age 65, had never reviewed their plan. They were on the most expensive Medigap plan from Blue Cross. They were on the most expensive prescription drug plan. So they were both paying $125 a month just for their prescription drug plan, and they didn't realize they weren't even getting all of their medications covered. They were paying the full cost for some of their medications. So we reviewed their plans, and we were able to switch them and save them a significant amount of money just because they had never had their plans reviewed. It is important to have that done every year. And then if you're on a Medicare Advantage plan, this is fairly new, started a few years ago. There's also an open enrollment period that begins January 1 and runs through March 31st. If you have a Medicare Advantage plan and you want to either switch your plan or drop it and just go back to original Medicare, you can do that anytime during January through March 31st. There are reasons some people would do this is maybe they didn't review their plan during the annual enrollment period. And when January came along, they went to the pharmacy. They just assumed because their plan covered all their meds the previous year that it was going to continue, and it didn't. So they went to the pharmacy and found out that one of their expensive medications wasn't going to be covered. Well, that's one reason you want to review it during the October timeframe. But if you don't, there's one more option if you have a Medicare Advantage plan to review it and switch to a plan that is going to meet all of your needs. Delaying Medicare benefits. So we talked about this a little bit, but if you're working past the age of 65, you or a spouse, we can compare costs of what it would be if you stayed with, if you're on the Mayo plan versus going on to Medicare. I've done enough of these comparisons to know the Mayo plan is going to be more competitive for you than going on to Medicare if you or your spouse is going to work beyond the age of 65. The Mayo's plan is deemed creditable by Medicare. If you have an HSA account on your employer plan where you're contributing and they're contributing to a health savings account, you do not want to sign up for Medicare Part A. If you sign up for Medicare Part A, you are not allowed to contribute to an HSA account any longer. When you're ready to retire, you would want to stop contributing to your HSA account several months before applying. Technically, you'd want to stop contributing 6 months prior. But if you don't do it that soon, you could potentially get taxed. It's not a huge tax, but you would get taxed on your HSA contributions. But if you're in that situation, typically the good advice is if say you're going to retire in June of whatever year, when your annual enrollment for your employer plan comes along, opt not to contribute to the HSA starting in January, and then you won't have to deal with that. You can apply for Medicare Part A and B online. That's something that we can help you with it if you need help with that. So applying for Medicare A and B online is simply going to the Social Security website, which is ssa.gov, and there's an icon right on their homepage to sign up for Medicare. You can go to your local Social Security office if it's being staffed, or you can call them on their 1-800 number, but plan to be on hold for a few hours if you do that. So again, that's a service we offer at no charge if and when the time comes for you to sign up for Medicare A and B. And then if you've delayed your Part B enrollment beyond the age of 65, there's a Part B form that gets submitted that you get from your employer, and it looks like this. It's called the Request for Employment Verification. It's a one-page form that Human Resources from your employer will complete. You'll do a section, they'll do a section, and this is just telling Social Security when you go to apply for Medicare Part B that you had coverage beyond the age of 65, and this is what prevents you having to pay a penalty for not signing up at age 65. If you do it electronically, you just submit, you upload the form. If you apply online, if you go to the Social Security office, you'll take this form with you. Any questions on that? Okay. Their income has impacts on your costs for Medicare. If you fall into the low income category, there's something called extra help available for your Part B premium and your Medicare Part B, or Part D, excuse me. So at the top of this chart, you'll see what says family size. The percentage is the percentage of the federal poverty guidelines. So if you're at 100%, 135, up to 150%, if your family size is 1, if your income falls below these amounts, it's likely that in Minnesota at least you would qualify for extra help. And as you can see, if you add to the size of your family, whatever those dollar amounts is, that's the maximum your income could be based on the federal poverty guidelines to receive extra help for your Medicare. The other side of that is if you're high income, there's something called an income-related monthly adjustment amount, or the IRMA. And for this year, if you file your taxes singly and your income, so they look at your modified adjusted gross income from 2 years ago. It's always going to be from 2 years ago. If your modified adjusted gross income from 2 years ago, if you filed your taxes singly, was $106,000 a year or more, then you're going to have a surcharge added on to your Part B premium and your Part D premium every month for the rest of the year. If you're married and filed your taxes jointly, if your modified adjusted gross income from 2 years ago was $212,000 a year or more, you will have surcharges added on to your Part B and Part D premiums. So you can see here, if your income was between $212 and $266, your premium goes from $185 to $259, and then that just goes up based on your income, and then your Part D goes up. And again, that would be every month for the rest of the year, and then every year Social Security reevaluates this. They work with the IRS to determine if and when your income has dropped below those levels you would no longer have that surcharge to pay. Any questions on the income guidelines? Okay. Private health insurance options. There's different options available. There's what's called supplement or Medigap plans. There's Medicare Advantage plans, also called Part C, and then there's Medicare Part D plans, and we will go over each of those. So Medigap plans or supplement plans, in Minnesota, we call them different than what most of the country does. Most of the country is going to assign a letter to them, like Plan F or G or K or L. In Minnesota, we call them basic, extended basic, a copay plan similar to Plan N, high deductible similar to Plan F, and so forth. With Medigap plans, there are no networks of providers. If the provider takes Medicare payment, they will accept your Medigap plan, and that's going to be true across the country. It travels with you. Let's say if you were to move, you sign up for your Medigap plan in Minnesota, and then you're going to move to another state, that plan will move with you. The downside to that is Minnesota has some of the most expensive Medigap plans in the country. So that may not necessarily be a good thing for you. If you signed up for a Medicare Advantage plan and moved to another state, you're going to lose that plan, and then you would have the option of either signing up for a Medigap plan in that state or a Medicare Advantage plan without any health questions being asked. So that's one of the differences there. If you're going to stay in Minnesota, then you wouldn't have to worry about it. But so they do travel with you when you leave, and if you were to locate to another state, they do give you coverage all across the country. Yes?
So you're saying that Minnesota Gap plans are the most expensive in comparison to others?
Yes. They're some of the most expensive, yeah.
Some of the most. So if you were to move, say, to another state, you're still going to pay the same premium?
You will.
Even though you're completely in a different state?
Yes, and that's because if you sign up for a Medigap plan in Minnesota, you don't lose it if you move to another state.
Okay.
With a Medicare Advantage plan, you would. With a Medigap plan, you wouldn't. I can give a for instance, a Blue Cross plan from Senior Gold, when you take the add-ons that cover everything, if you're a non-smoker this year, that runs about $310 a month. I worked with a lady, a credit union member who moved out to North Carolina. Her plan, almost exactly the same, was $160 a month. So big difference in pricing. I don't know why Minnesota's more expensive, they just are. With Medigap plans anyway. You won't be asked any health questions if you join a Medigap plan within 6 months of signing up for Part B. Traditionally, if you didn't sign up for a Medigap plan and then down the road you're still a Minnesota resident and you wanted, let's say you started out with an Advantage plan and wanted to move to a Medigap plan, in the past you would be asked health questions. The Minnesota legislature has created an annual enrollment period for Medigap plans in Minnesota. That starts in October of 2026, so October of next year. And what that means for Minnesotans is if you started out with an Advantage plan and did want to move to a Medigap plan down the road, you would be able to, you're going to be able to do that without any health questions being asked starting next fall in 2026. There's a few states that are already doing that. Minnesota's joined that small group of states that will allow you to enroll in a Medigap plan beyond your originally enrolling in Medicare without being asked health questions if you do it during the annual enrollment period, which that's the same as they are for Advantage plans. That's October 15th through December 7th. This is not true in most states, but in Minnesota, it's a new law that goes into effect next year.
So people that are on it now, then, since it goes into effect next year, they can still do it then?
They can.
Down the road.
Anybody who's not on a Medigap plan starting next fall, if they want to move on to one, they're going to be able to do it during that time frame without being asked health questions. And then it goes into effect January 1 of the following year. With Medicare Advantage plans, so in Minnesota we also have what's called Medicare cost plans and we have Medicare Advantage plans. There are networks for Medicare Advantage plans. The plus with being, if you live in Minnesota, I know people online may be in other states, but in Minnesota we have probably the strongest Medicare Advantage plans in the country. We have insurance carriers that 97% of providers are in network with their Medicare Advantage plans. So just about everybody who takes Medicare in Minnesota would be in a network for your Medicare Advantage plan. That's not true in a lot of states. It is true in Minnesota. With Medicare Advantage plans, along with the medical, they offer you comprehensive dental, vision, hearing exams, free gym memberships. They give you maximum out-of-pocket protection, which means if your copay is added up to whatever the maximum out-of-pocket, let's say if it was $3,000, if your copay is added up to that before the end of the year, then the plan covers you at 100% if you were to hit that maximum out-of-pocket protection. Again, there are networks for these plans, but there's very strong networks in Minnesota. There's a couple different types of Medicare Advantage plans. There's HMO plans and there's PPO plans. HMO plans, I tend to keep my clients away from those because you're restricted when you're traveling, and typically you would need a referral to see a specialist. With a Medicare Advantage PPO plan, which most of the plans in Minnesota now are PPO plans, you have coverage. PPO plans will give you coverage all across the country, and you don't need a referral to see a specialist. So they have more flexibility, the PPO plans, than the HMO plans do. Advantage plans don't move with you, so they're based on the county where you live. If you moved from one county to another in Minnesota, you may need to look at finding a Medicare Advantage plan in that county, or if you move to another state, then you would need to find a plan available in the county of the state to which you moved. Medicare Advantage plans don't ask you any health questions. The plan benefits and premium can change from year to year. With Medigap plans, the benefits don't change, but the premiums can change from year to year. With Advantage plans, the benefits and premiums can change from year to year. Yes?
We have a couple questions coming in online that we're going to save towards the end, but one that just came in related to the previous slide Is there a deductible for original Medicare plans A and B?
If you just have original Medicare, there is a deductible. If you don't add on any type of supplemental coverage or advantage, the Part A for the hospital, let me go back to that. You would have a deductible of $1,676 if you went to the hospital. And for Part B, you would have a deductible of $257. Then for Part B, after your deductible, if all you have is Medicare Part A and B, you're going to pay 20% of whatever your medical bills are. So if you have something catastrophic happen, and for your Part B at least, there's no maximum out-of-pocket protection if you just have original Medicare and no supplemental coverage. So it could get pretty expensive if you chose to go that route. Is there another question or no? Okay. Let's see. Excuse me. And then we have what's called standalone prescription drug plans or Part D plans. Your Part D prescription drug, if you get a Medicare Advantage plan, that's included in your plan for the monthly premium. If you go with a Medigap plan, this is where you would want to add on a standalone prescription drug plan if you wanted prescription drug coverage. Each insurance carrier's formulary is different. A formulary is a list of the medications that they cover. They vary from one company to the next. So if you meet with us, one of the things we will do is we'll ask you to bring a list of your medications or prescriptions that you're taking, and we will look them up to make sure that whatever plan that you choose is going to cover all of your medications. Every plan offers mail order service, and then there's different tiers of coverage. So with every carrier's formulary, tiers 1 and tier 2 are typically generic medications. Tiers 3 and 4 are going to be brand name medications or the higher priced generic medications. Tier 5 would be specialty medications. And then some plans have a tier 6, which is the low cost generic medications. I'm noticing that a lot of the plans are getting away from the tier 6, but some still do have that. And then some people don't want to sign up for prescription drug coverage when they're first eligible because they say, I'm not taking any prescriptions and I never will. You can do that if you want to, but down the road, if you do end up taking prescriptions and want coverage, there's going to be a late enrollment penalty. It's 1% of the national average, which comes out to about $4 a month for every year that you went without. So if you went 5 years without coverage and then decided to sign up for it, if you take 4 times 5, that's about a $20 per month late enrollment penalty that would get added on to your monthly premium, and you're going to pay it every month the rest of the year. So I always advise my clients to sign up for something. If you're in that good of health and you're not taking any medications, you can get a 0 premium Medicare Advantage plan where you don't pay a monthly premium that includes medical and prescription drug coverage, but at least you have coverage so down the road you don't have to face a penalty if you decided. If you know you're just never going to take prescriptions, then you don't have to if you don't want to. It's a personal choice. And then new for this year, Medicare has capped medication costs at $2,000 per year per beneficiary. So this $2,000, it's typically not a true $2,000 that's coming out of your pocket. It's a complicated formulary and it's based on a national average. But once Medicare has determined that you've reached that $2,000 cap, again, starting this year, your insurance carrier, if you reach that cap, will have to pay 100% of the cost of your medications. So for some people, that's a huge benefit. There used to be something called the donut hole or the coverage gap, and if you fell into that donut hole, then you had to pay 25% of the cost of your medications, and there were just some people that was a very expensive time for them. Well, with your cost being capped at $2,000 per year, it's really helping consumers not having to bear so much of the financial cost. It's tough when you're retired and on a set income to be able to do that. If you're someone, let's say you're on a tier 3 medication like Jardiance or Ozempic or Wegovy where you're going to hit that $2,000 cap probably in 2 to 3 months. For you to pay out $2,000 or something close to that in the first 3 months of the year, that can be challenging for some folks. So every insurance carrier is required to offer a payment plan if that's something you're interested in. And instead of having to pay that $2,000 in the first 2 to 3 months, the insurance carrier spreads that cost out over 12 months to help you make it more affordable to you. And if you choose to sign up for the payment plan, when you go to the pharmacy, you won't pay anything for your medications. Your insurance carrier will bill you for them. So that's new for this year. Any questions on that? Okay. So I explained this. It's the Medicare prescription payment program. And again, it's just a way to help folks if money is tight and you have some expensive medications.
So that happened this year. It could be taken away at any point.
Any of this can be taken away at any point. So, yeah. Premium costs with Medicare and private health insurance options. So, kind of recap, if you have on the left, if you go with a Medicare Advantage plan, at least in Minnesota, you know for your Part A, you won't have a premium. Part B is $185. And then Medicare Advantage plans, almost in every state, there are 0 premium plans. And Minnesota, and in this area, they can go to $100, $150 or more, depending on the insurance carrier you want to go with. When you go that route, you get your medical, prescription drug, dental, vision, hearing, all of that's together for that 1 monthly premium. On the right, your Part A and Part B premiums are still going to be the same. If you go with a Medigap plan, if you wanted a high deductible plan where you pay the first $2,800 in your costs, those are going to start around $60 to $75 a month. And if you wanted one where you just pay the $257 deductible and then everything else is covered, those are going to be closer to $300 or more per month. With these, it does depend on whether you're a tobacco user. If you use tobacco, your rates go higher. But Medigap plans, just to reiterate, don't include prescription drug coverage, dental, vision, hearing. If you wanted coverage for those things, you would add that on if you go with a Medigap plan. And then Part D, prescription drug plans, there's one company that offers a 0 premium plan in Minnesota this year for prescriptions. And then those can go up to $100 or more based on the plan, based on the prescriptions that you're taking. So Medigap plans can tend to be more expensive, but there are reasons why you may want to go with one versus an Advantage plan. And if you meet with us, we sit down and we'll ask you those types of questions. And it's really what matters most to you. I'm not here to push you into one plan or the other. I want you to choose what you're comfortable with and what's most important to you in a Medicare plan. So what's next? You got a folder, and if you're online, you'll be receiving the handouts via an email this afternoon. But there's a form in here. If you want us to help you when the time is appropriate, if you fill out the form that's in your folder and leave it with us, then as long as you leave an email address, we'd prefer to email you than try to call you because that's just gets to be inconvenient for everybody. But we will send you an email thanking you for coming and then just asking you, when do you plan on retiring or when do you plan on needing Medicare? And we'll follow up with you when the time is appropriate. You're not required to fill anything out from coming today, but if you want our assistance with any of that, if you fill that out, like I said, and leave it with us, we'll email you and then we'll be in touch as whenever the time is appropriate for you. So, any questions? Yes?
So the Medigap plan moves with you, but if you have a Medicare Advantage plan, when you move to another state, you have to pick something.
Yes, so Medicare Advantage.
You moved in the middle of the year instead of during annual enrollment.
So if you move in the middle of the year and your Advantage plan isn't available in that state, which it wouldn't be, you have a 60-day time frame in which to find a new plan based on when you notify Social Security of your move. And we're licensed in numerous states, so that's something we can help you with if you need it. But yes, if you have a Medicare Advantage plan and you move, it's likely you'll need to find a new plan. If you have a Medigap plan, you wouldn't need to switch your Medigap plan, but you would need to find a standalone prescription drug plan for the area where you moved.
Okay, but if you want, it would depend on what, well, I guess you can always go from a Medigap to a medical advantage without health questions,
Yes.
the other way back. So how can you find out which states don't ask you those questions?
So if you move to another state and you lose your Advantage plan, you can get a Medigap plan in any state without being asked health questions because you lost your plan against your will. Yeah. Were there any questions online?
Will underwriting be required for coverage if you wait until the special enrollment period?
Oh, like if you work beyond the age of 65? No, underwriting, it's going to be based on, there won't be underwriting for Advantage plans, but for Medigap plans, it's based on when you sign up for your Medicare Part B, on your Part B effective date. So if you hold off on signing up for Part B and sign up for that based on your retirement, then there would not be underwriting questions for your Medigap plan initially.
One other question, if their birthday is in December, can they start coverage the following January? Is that how that works?
So the coverage would always start the first day of the month you turn 65. So if you were born in December, it would start December 1. The caveat to that, if your birthday is actually the first day of the month, you can start it the month prior, but it would start the first day of the month. But if it's based around the age you're 65, you do have 3 months following your 65th, the month of your 65th birthday, to start a plan also. Any other questions? You guys would be the easiest group I've had all week.
Dave, you mentioned that you and your team would be open to meeting with Mayo employees even if they are going through via benefits.
Yes.
So is that a type of meeting where you could help advise or clear up questions of what via benefits plans offer, things of that nature?
Yeah, I believe Via Benefits offers all the plans. From the experience I've had with meeting with people, they tend to steer people towards a couple, and I don't know why. I can't say that's always true. But yes, we can advise you. We can look up your medications, and we can just say, based on what you've told us, we think this would be your best option. And you can, when you have a meeting with Via Benefits, you can tell them what plan you want, or if you want to listen to them, you know, explain to you. If they think there's something better, you certainly can. But they're not based in Minnesota, so I think we know, at least for the Minnesotans who are needing our help, we have a pretty good idea. We have a very good idea of what plan is going to work well for you. Now, this is a picture of our team, and yeah. Well, I'll be around afterwards if you have any questions you don't want to ask in front of the group, but thank you for coming today, and we'd love to work with you when the time comes if you need help.